Hi, my name is Lisa. I have been an above-knee amputee since July 7th of 2017. I also had a below-the-knee amputation done in February of 2015, and when I had that amputation, I did some inpatient therapy just for a few days after transitioning from the hospital to home, but after that I did not do any physical therapy. I just walked on my own and did things, and I definitely did not learn the proper techniques, the proper steps. I definitely got tired, my back hurt, things of that sort. So having become a above knee amputee, I've definitely realized and learned that therapy is a vital part of my getting better and getting stronger. It is completely different, of course, from a below knee amputation to an above knee, but the process of therapy is so helpful in so many ways. I mean, it makes you stronger, it makes you a better walker, makes you walk properly so you're not hurting, your back's not hurting, everything's not hurting, but it's also a great support for you when you come in. You work with your therapist one-on-one and they help you, they listen. They teach you the proper way to do things and how to do things and make you, better at what you're doing. So I really, really have come a long way having done the therapy this time versus last time. I walked fine, but now I walk straighter and I walk better, and I'm getting stronger every day because I'm learning how to do things properly. But one of the most important things, like I said, is when you come in, they give you the support that you need and the help that you need to get you to your goals, so that when you're ready, you'll be able to go out and walk in the grass or walk through rocks or walk on a hill and not be afraid to just do what it is you want to do, and you'll be able to go everywhere and you won't miss out on things that your kids are doing or family events, things of that sort. So I definitely have learned a lot. I'm very grateful for all the help that I've received with my therapy, and you got to dedicate a lot of time, but it's worth it. It definitely makes you stronger. It teaches you the proper way to do things. It teaches you a much more efficient way to walk and to not hurt. When you're walking, if you don't learn the proper techniques and the proper patterns, your back will hurt every day. You'll be more tired. You'll just feel very sluggish. You won't want to get up and do things because you'll feel so run down and you're not doing it properly. So your back's hurting or your other leg is hurting, things of that sort. Definitely something that I've noticed from not doing the therapy from below knee to above knee. It definitely, my back hurts a lot less, like almost not at all, now that I've been doing therapy for a couple months. And also, when you're out, if something does happen to you and you fall, you're not afraid to fall because they teach you the proper techniques of how to get up. They also teach you techniques of how to try not to fall if you start to stumble. They teach you the techniques to try to save that from yourself from falling, basically, to stay on your feet. You might be a little wobbly, but you don't end up on the ground. But when you do, you'll at least know what happens, how to get up, how to be safe about getting up, instead of being so worried that you're going to fall out in public or even in your home that you're afraid to use your prosthetic. Definitely, though, as far as just the walking, I definitely am getting better at it, using less energy. They've taught me proper technique, proper gait pattern to walk so that my back is level, my hips are level, I'm not hurting, I'm not leaning to the side, I'm not limping. All those things are really important. And most people want to learn how to walk properly so they don't even look like they have a prosthetic leg. That's important to a lot of us. We want to look like we're just a normal person walking down the street. And that's all part of therapy. They help you to do all those things and to use a lot less energy doing it and to be a lot safer while you're doing it also.